You might be wondering, why does turning 40 matter so much when it comes to pain? Well, your body undergoes significant changes during your fourth decade and beyond. Your metabolism slows down, your bones start losing density at a faster rate, your cardiovascular system begins showing the cumulative effects of years of wear and tear, and chronic conditions that were silently developing finally start showing symptoms. Here's the thing that most people don't realize, pain after 40 is fundamentally different from pain in your 20s and 30s. When you're younger, pain is usually acute, meaning it comes from a specific injury or strain and it heals. But after 40, pain increasingly becomes a messenger, a warning system telling you that something deeper is going wrong. Think of it this way, your body is like a car. When a car is new, a warning light usually means something minor. But when that same car has 100,000 miles on it, that warning light could mean your engine is about to fail. Your body works the same way. After 40, you've accumulated mileage, and those warning lights, those pains, they mean more. Let's start with the most critical pain of all, chest pain. If you're experiencing chest pain, discomfort, pressure, squeezing, or fullness in the center of your chest that lasts more than a few minutes or goes away and comes back, you need to take action immediately. Many people, especially over 40, dismiss chest pain thinking it's heartburn, indigestion, or just stress. And sometimes it is. But sometimes it's a heart attack, and the difference between those two scenarios is literally life and death. Here's what you need to know about heart attack symptoms. It's not always the dramatic clutching of the chest you see in movies. For many people, especially women, heart attack symptoms can be subtle. You might feel pain or discomfort in one or both arms, your back, neck, jaw, or stomach. You might have shortness of breath with or without chest discomfort. You could experience cold sweats, nausea, or lightheadedness. Now, why is this especially important after 40? Because your risk of heart disease increases significantly. By age 40, about 1 in 2 men and 1 in 3 women will develop cardiovascular disease in their lifetime. If you have risk factors like high blood pressure, high cholesterol, diabetes, smoking, obesity, or a family history of heart disease, your risk is even higher. So here's my rule: if you have any chest discomfort that concerns you, especially if it's accompanied by any of those other symptoms I mentioned, call emergency services immediately. Don't drive yourself to the hospital. Don't wait to see if it gets better. Don't worry about being embarrassed if it turns out to be nothing. The medical professionals would much rather you come in for a false alarm than die at home because you were too hesitant to seek help. 8 to 12 o'clock, abdominal pain, the silent killer. Next, let's talk about abdominal pain. Your abdomen contains so many vital organs: your stomach, liver, gallbladder, pancreas, intestines, appendix, and reproductive organs. Pain in your abdomen after 40 can signal serious conditions that require immediate attention. Sudden, severe abdominal pain should always be evaluated immediately. This could indicate appendicitis, a perforated ulcer, ruptured organ, or an abdominal aortic aneurysm. That last one is particularly dangerous. An abdominal aortic aneurysm is a bulge in your aorta, the main blood vessel that carries blood from your heart through your abdomen. If it ruptures, it's often fatal. The risk increases significantly after 60, especially in men who have ever smoked. But it's not just sudden pain you need to worry about. Persistent abdominal pain that doesn't go away, especially if it's accompanied by other symptoms like unexplained weight loss, changes in bowel habits, blood in your stool, persistent nausea or vomiting, or jaundice, that yellowing of your skin and eyes. These combinations can indicate serious conditions including colon cancer, pancreatic cancer, liver disease, or inflammatory bowel disease. Here's what many people don't realize: colon cancer rates are actually increasing in people in their 40s and 50s, even as they are decreasing in older adults. This is partly why screening guidelines now recommend starting colonoscopies at 45 instead of 50. Gallbladder problems also become more common after 40. If you experience pain in the upper right portion of your abdomen, especially after eating fatty meals, along with nausea or fever, you could have gallstones or gallbladder inflammation. While not immediately life-threatening, untreated gallbladder problems can lead to serious complications. The bottom line: don't ignore persistent or severe abdominal pain. Your abdomen is not a place where you want to play the waiting game. 12 to 4 p.m., back pain, when it's more than just a sore muscle. Almost everyone experiences back pain at some point. In fact, it's one of the most common reasons people visit the doctor. Most back pain is mechanical, meaning it's related to the way your spine, muscles, and joints move and work together. This type of pain usually improves with rest, physical therapy, and time. But after 40, certain types of back pain can indicate serious problems. Back pain accompanied by numbness, tingling, or weakness in your legs could indicate nerve compression or spinal stenosis, a narrowing of the spaces in your spine. If you're experiencing loss of bladder or bowel control along with back pain, this is a medical emergency called Cauda-Equina syndrome, back pain that's worse at night or when you're lying down, especially if it's accompanied by unexplained weight loss or fever, could indicate spinal infection or even cancer that has spread to your spine. This is particularly important if you have a history of cancer. Back pain following a fall or injury when you're over 40 deserves special attention because your bones are more susceptible to fractures, especially if you have osteoporosis. Women are particularly at risk because bone loss accelerates after menopause. Here's something many people don't know: sometimes back pain isn't actually coming from your back at all. Kidney stones, kidney infections, abdominal aortic aneurysms, and even pancreatic problems can cause back pain. So how do you know when back pain is serious? Look for these red flags: pain that doesn't improve after a few weeks, pain that's severe and doesn't improve with rest, pain that spreads down one or both legs especially if it extends below the knee, pain that causes weakness, numbness, or tingling in one or both legs, pain accompanied by unexplained weight loss, pain accompanied by fever or chills, pain in someone with a history of cancer, or pain following a significant fall or injury. Headaches are incredibly common. Most of us have experienced tension headaches or migraines. But certain headaches after 40 require immediate medical attention. A sudden, severe headache that's different from any headache you've had before, often described as the worst headache of your life, could indicate a brain aneurysm or bleeding in your brain. This is a medical emergency. Headaches accompanied by fever, stiff neck, confusion, decreased alertness, vision changes, difficulty speaking, numbness, weakness, or seizures need immediate evaluation. These could indicate meningitis, encephalitis, stroke, or brain tumor. Headaches that progressively worsen over days or weeks, especially if they are worse in the morning or wake you up from sleep, could indicate increased pressure in your skull from various causes including tumors. If you're over 50 and develop new headaches, especially if they are around your temples, accompanied by jaw pain when chewing, vision problems, or scalp tenderness, you might have temporal arteritis. This is an inflammation of the arteries in your head that requires immediate treatment to prevent vision loss or stroke. The key is knowing what's normal for you. If you're experiencing headaches that are different in character, intensity, or pattern from your usual headaches, that's a reason to see your doctor. 19 to 10 p.m., leg pain and swelling, the clot you can't see. Leg pain might seem minor, but it can indicate serious circulatory problems, especially after 40. Deep vein thrombosis, or DVT, is a blood clot that forms in a deep vein, usually in your leg. It can cause pain, swelling, warmth, and redness in the affected leg. Why is DVT so dangerous? Because if a piece of that clot breaks off, it can travel to your lungs and cause a pulmonary embolism, which can be fatal. Risk factors for DVT increase with age and include prolonged sitting, recent surgery, cancer, smoking, obesity, pregnancy, and certain medications including hormone therapy. Peripheral artery disease, or PAD, is another serious condition that becomes more common after 40. It's caused by narrowed arteries that reduce blood flow to your limbs. Symptoms include leg pain when walking that improves with rest, coldness in your lower leg or foot, numbness or weakness, slow wound healing, and changes in the color of your legs. PAD is often a sign that you have atherosclerosis, the buildup of plaque in your arteries throughout your body, which increases your risk of heart attack and stroke. In fact, if you have PAD, you have a 6 to 7 times higher risk of heart attack or stroke. Here's the action item: if you experience sudden leg pain and swelling, especially in one leg, don't wait. Get evaluated immediately. If you have leg pain when walking that consistently goes away with rest, make an appointment with your doctor soon to be evaluated for Take care of yourself, listen to your body, and remember, it's always better to be safe than sorry when it comes to your health. Thanks for watching.